Magandang gabi mga kaibigan. Welcome po dito sa Radyo Klinika sa DWIZ. Ako po si Maru Pahati Sarne at kasama po natin mula pa po sa Amerika, no? Siya po ay nagpakadalubhasa diyan po sa Harvard, MIT. Siya po ay nagsasagawa po siya ng volunteer work ngayon dito po sa Philippine General Hospital. Eksperto po sa testing. May PhD po sa molecular biology mula sa Harvard, MIT. And of course, Dr. Nayan is also here with us to explain to us about the RT PCR test at iba pang mga may kinalaman po sa COVID. Wala pong iba kundi ang ating kaibigan po ngayon na nandito. Kasama natin, Dr. MARVIN Nayan, PhD. Doc, magandang gabi sa iyo, Dr. Nayan.
Good afternoon po. Thank you for having me.
Oo, thank you so much. At ikaw ay nag-volunteer work pala dyan sa PGH. What do you exactly do?
So, right now, I'm helping with the testing efforts at PGH and at other testing facilities. And also, I'm also working on a new project to help lower the cost of testing to make it more accessible
Oh,
for
wow.
everyone.
Okay. Kailan ka pa nandito, Dr. Nayan? And nakaka-speak ka ba ng Tagalog, ng Filipino?
Maintindihan ko, but I prefer English because I'm self-conscious.
Nako, sorry Yung mga ipinadala kong question sa iyo, Filipino, pero naintindihan mo ang Filipino naman,
Oh,
Dr. Nayan. Oo.
opo,
Oo.
opo.
How long have you been here in the Philippines?
Since February.
Noong February pa. So talagang pumunta ka dito sa Philippines because of COVID or meron kang ibang
So,
mm.
so actually, I just graduated from MIT in
Wow.
January, and as you know, as when you after you graduated, your family in the Philippines, they wanted to see you and celebrate.
Yes.
So after I graduated, I went to the Philippines in February,
Oh.
but then I got stuck here because of ECQ,
Yeah, yeah.
right? So what was supposed to be a 1 month vacation for me
Mm.
turned out to be, been a working, just been working help our testing efforts here for the past 6-7 months or so.
Oh, okay. So swerte namin pala. Swerte namin na na-stranded ka dito sa Philippines because of the celebration. Pero ngayon, you are helping out nga dyan sa Philippine General Hospital in the testing and also in explaining to our experts here yung kung paano talaga nag-work itong RT-PCR. At yan ang ibabahagi mo ngayon dito sa ating mga tagapakinig sa Radyo Klinika. Unang-una ba, Dr. Nayan, ano ba ang RT-PCR? Ano ba ang ginagawa niyan? Reverse
Okay.
transcription polymerase chain reaction. Yan yung kanyang buong pangalan.
Correct.
Oo. Anong
Correct.
ginagawa niyan? Oo.
So in the context of trying to detect the virus that causes COVID, which
Mm-mm.
is SARS-CoV-2, severe acute respiratory disease,
Mm-mm.
coronavirus 2.
Mm-mm.
So in order to do that, one of the gold standard to detect it is called, as you mentioned, RT PCR.
Mm-mm.
And what essentially that does is that you try to make many more copies of that so our machines can easily detect it. And
Mm-mm.
in general, it's been the gold standard for detecting the genetic material of the virus that causes COVID, SARS-CoV-2, that causes COVID.
Mm-mm. Okay. So ang ginagawa, kinukuha yung selula nung tao, no? Through the swab test. The cells. You get the
Yes,
cells.
yes.
Oo.
Usually, you get a nasal swab from both nostrils,
Mm-mm.
and typically, sometimes it may be uncomfortable to people, but you
Yes.
really
Oo.
want to get a good collection. If you are infectious, so you get a swab, and they swab you pretty deep into the nasal cavity,
Mm-mm.
and then from there, from this after the swabbing, you traditionally try to extract the genetic material,
Oo.
and then you go through, as the name suggests, polymerase chain reaction, meaning that you use these molecular machines called enzymes to make many more copies, because the genetic material is just like DNA. It's very very small. So
Yeah.
in order for us to detect it reliably, we really need to amplify it and make millions of copies. And that's why it takes a long time, because it takes several hours to make millions of copies of this, so that our machines called thermal cyclers are able to detect it.
Kaya pala hindi katulad ng sabi nila rapid test, just put your blood, ando na yung result. Pero with the RT PCR, you have to wait at least 24 hours ba?
Yeah, so there's that is a big issue, which is called turnaround time, the time from swabbing
Yeah.
to getting your results. And as you know, if you get the results too late, it may not be useful, at least from a public health perspective,
Yeah.
because so ideally you really want a turnaround time as short as possible for PCR based testing. At least at PGH, we try to aim for 24 to 72 hours, but that depends on a lot of things. There are, sometimes there are backlogs and just supply constraints and encoding constraints that really push the time to release the results, up to 7 days. And in general, we should really try to avoid that and get it as fast as possible.
So this is the reason why DOH cannot provide us with a parang on-time na results, ano? Kasi parang people are expecting na kapag sinabing ito ang daily count ng COVID cases, ito yung dapat na nanggaling na kaagad mula sa laboratory. Pero not all laboratories can produce within 24 hours or 72 hours na results. Kaya may mga parang tinatawag na late cases. Kasi mga
Opo.
3 days and beyond pa yung kanilang mga last test. Eh kung
Exactly.
yeah, kung gano'n na parang kung kunyari 3 days and beyond pa o late na yung cases, is it still valuable yung mga figures na yon mula sa results sa ating pagbibilang ng
So
COVID cases?
it if you know in my opinion, not really,
Oo.
because unless you're self quarantining, um, for when you're waiting for the results, you don't know exactly if you're infectious or not. So we really should aim for as quick of a turnaround time as possible. So so again, it's sometimes it's very very difficult because of infrastructural and
Yeah.
coding issues, but that is something I think we're getting better at.
Okay. Sa day one pa lang ba ng infection, can you already get the virus? Can you already detect the virus through the RT-PCR? Kapag day one pa lang ng infection ng tao?
Um, Most likely not.
Okay.
So it's so this is going to get a bit technical.
Yeah.
And again, the science here is still we're still trying to figure it out. But what we know so far, there's really an incubation time from from day of infection to the time we're able to detect it. And the time we're able to detect it depends on the test, whether we're doing the rapid test or doing the PCR test. But usually, the day you're infected, it's really difficult to actually detect it, because the virus hasn't replicated yet. It takes some time, called the incubation time, to really have enough for our diagnostic test, whether it's the protein test, the antigen test, or the genetic tests, which are the RT PCR. So I can't give you an exact number, but it should be 7 to 14 days after infection is where we're readily, at least with good confidence, able to detect it. And the detection window is separate from onset of symptoms. So that's one thing I want everyone to understand.
Yeah.
Because what's different about COVID is that is that when uh, is that when you're most infectious, 2 to 3 days before onset of symptoms. At least when you become, for those that become symptomatic.
Yeah, yeah.
Uh, so so uh, so if so again, it's the whole diagnostic testing thing, especially with this virus, is very complicated, and I understand there's a lot of confusion, and
Yeah.
trust me, scientists are also, trying their best and trying to sort out exactly what this is. And you have to understand, this virus, we only know it, known its existence
Mm-mm.
since January, so there's a lot more we don't know than we know right now.
Oo, oo, oo. So, you said that on day one, you might not be able to get that much virus from the swab test. So, pwedeng mag-negative doon sa RT PCR, yung isang patient
Yeah,
na
and
ini-swab. Oo. Mm-mm.
correct. So one thing, what's one thing that's important to know is that for these antigen, or for these tests to detect whether you're infectious, which could be the RT-PCR, which is what most of the country here is doing in the Philippines, is that it's only good at the time you took the swab.
Mm-mm.
What that means is that after that, so that's why it's important to have fast results,
Mm-mm.
because it's only detecting that whether you're infectious or not at the time of swabbing,
Mm-mm.
right? So you could have been infected the same day, but you may not have enough
Yeah.
virus. So therefore, when you get your results 2 to 3 days later, it says negative.
Mm-mm.
But 7 days later,
You are
you may have been
positive.
actually positive.
Mm-mm.
So that's one thing you need to know. Like, so so that's why I've been advocating, and many others,
Mm-mm.
at least for at-risk people, um, or and healthcare workers, they
Mm-mm.
need to be tested regularly.
What
Just
and
because
what is
you
regular?
got
Every 7 days?
well,
Mm-mm.
so it depends on, the policy and resources,
Mm-mm.
but a good balance should be every 2 weeks.
Every two
But
weeks.
again,
So.
uh, I would argue, every week.
Mm-mm.
But again, we have, supply constraints, and
Yeah,
and
yeah.
we still have, limited resources. So
Mm-mm.
right now we still can't get to that threshold.
Oo. Eh, 'di ba parang the Philippines has its own ano na, RT-PCR test kits? Are you already using those ano, invented by a Filipino scientist? Have
So
you heard about it?
you
Oo.
maybe yeah,
Oo.
I actually worked with that scientist
Mm.
at UPNIH.
Oo.
So right now, the UP test kits, um they're still in the process of validation. So they had to make a new version.
Oh.
But
Okay.
hopefully, we're able to get that, because it is much more affordable
Mm.
than the test kits we procure from abroad.
Yeah, oo.
But as usual, these tests are highly sensitive, and needs to be validated, and that's why it's taking a long time for the locally made test kits. But we hope, and a lot of people here hope that we can make our own. So
Yes.
we're working on that.
Oo. Pero kung ang isang tao ay asymptomatic, there are no symptoms, does it mean konti rin lang yung kanyang viral load and he won't be that infectious?
So no, actually.
Ah,
So
okay.
that's the thing about this virus, is that there's a large proportion of people that get infected but never get symptoms,
Mhm.
but they're just as infectious.
Mm, mm.
So that is based on our recent papers that show that asymptomatic transmission is really the major driving force.
Mm.
And you may be questioning, how can you predict whether someone is asymptomatic, will be asymptomatic or symptomatic, and we're still trying to figure that out. But the fact that we don't know, we should
Mm.
really be advocating for more testing for asymptomatic people, because that is the major driver of transmission, at least in Metro Manila right now.
Mm.
So right now, it's you have to pay out of pocket to if you're asymptomatic and you are not a healthcare worker.
Yeah.
So we're a lot of people in the government are trying to change that, but obviously it costs money to do tests.
Mhm.
So we're trying to lower the cost of the test, so that people that are more asymptomatics, which are the primary drivers of transmission,
Yes.
are able to be tested. And that's why testing is so important. Not
Yeah.
only for people that are symptomatic, but in order to really control the virus, we really need to test asymptomatic people.
Yeah. Would you know kung how much yung viral load ng isang tao through RT-PCR?
Yeah, so RT-PCR, when done correctly, will give you a relative measure of how much virus was taken at the time of your swabbing.
Hmm.
So, so, so,
So,
so
yeah.
yes, yes.
At
It
mape-predict
will
ba
give
nun?
you a
Yeah.
number.
Yeah. Yeah, please go ahead.
It can predict. Uh, there these are relative measurements, but it can predict whether you have a so-called high viral load
Yeah.
or low viral load. But
Ah.
regardless, if you're positive, regardless whether you have a high, medium, or low viral load, you're positive and you need to self quarantine and get to and talk to the relevant healthcare
Oo.
professional.
The reason why I ask yung about the viral load is because can it predict also if the patient will be critical or severe depending on the
Um,
viral load? Oo.
Uh, I don't think we know that yet.
Okay. Okay.
It's there's like I said, there's still a lot of things we don't know about the virus. And again, the time of the sampling, I think, matters, right? If you just got infected, you may have had a low viral load. But if you got swabbed maybe 7 days later, you may have had at the phase of high viral load.
Okay. Dr. Nayan, is it possible to have reinfection of COVID-19? Because our Secretary of the local government, Interior Local Government, Secretary Anyo, had COVID before and now he tested positive again. Ang ibig sabihin ba dito may reinfection?
So, based on the best available data, there is no evidence of reinfection
Okay.
right now. So, what will probably happen to the secretary is that if he tested positive and had COVID, that may have been a true positive, and then when he got tested again many months later, that was a false positive.
Huh?
And there are several reasons for having a false positive.
Yeah.
You may have remnants of the virus. It may not have been an active virus, but it's still there, and therefore the PCR test, which is again when done properly, is highly specific and can again make many copies, right?
Okay.
So it may have just the remnants of the old virus.
So
And also
pwedeng
it could
dead
just
na
have
yon?
been
Dead na yung virus na yon?
exa-
Pero na-detect
well,
pa rin? Ganun ba yun?
exactly. Viruses viruses are generally not considered living, but so we prefer inactivated. But that is correct. You may have remnants of the so-called dead virus, and therefore was picked up and was shown as a false positive. And again, this is not unique to the secretary. There have been reports of of getting positive again many months after the initial positive diagnosis in many parts of the world.
Yeah.
So this is not unique. And again, this can happen, and this is what happens when you have a really sensitive test.
But could it be because there's another strain that infected the person? That's why he tested positive again?
So when we talk about viral strain, typically these are just small changes in the mutation of the main virus. So it's very there are no reports right now that there is a so-called new strain that's able to reinfect previously infected people.
Ah, okay. Anyway, so what is the difference between the RT-PCR and the rapid test?
So basically, rapid, I don't really like that term because it's really relative, right? What is rapid? So, but for the purposes, what's important to know, and I'm sorry
Yeah.
if I get too technical here,
Yes,
but
yes.
basically, um, uh, basically as you know, there are the PCR tests that detects active infections, and that relies on detecting the genetic material of the virus. There is also an antigen test, right? An antigen test also takes a swab, but instead of detecting the RNA or the genetic material of the virus, it detects the actual proteins of the virus. And and uh, and you take a swab too, and basically most of the tests here in the Philippines are these so-called rapid antigen tests.
Yeah, yeah.
And for the most part, you need to really consult a qualified healthcare professional whether that's the right test for you, because most of the time, at least in the early batches of these so-called antigen tests, have been really poor performance. And so that's why I've been telling people that if you insist on getting these so-called rapid tests, you should ask, are these tests approved for use by the FDA? And if they're not, I would seriously reconsider taking those tests. And then
And sometimes they
again, these
do personal test, di ba? Self-test. They buy from the internet and then they do it at
yeah,
home. O how
yeah,
accurate are these tests, di ba? If they just do it at home and they are not even sure kung saan nanggaling yung mga test kits na yun.
exactly.
Oo.
Exactly. I understand everyone wants to
Yes.
have a quick, rapid test, right? But you have to understand that, again, most of these tests are not been validated, and it's very dangerous to rely on those results because it may give you a false sense of security.
Yeah.
So right now, I urge everyone, the first thing you should do is see, is this test approved by the FDA? And chances are it's not, at least at this time in the Philippines. And again, there's also another type of rapid test called an antibody test. And unlike the PCR test and the antigen test, a antibody test detects a previous infection.
Yes.
And you know this is an antibody test because you need to have a blood draw or like a blood prick to do them, because it detects any circulating antibodies in
Antibodies.
your
So.
blood. Yeah, and these can be rapid too. And just like my advice in the antigen tests, the antibody tests, you should really ask, has this been approved by the FDA? And if it's not, I would seriously consider taking this test and spending money on it and relying on its results.
How do you do the antigen test? Swab din ba yun? Swabbing.
Exactly.
Okay.
You can get the best sampling of the virus, because it is mainly considered a respiratory virus. You should get the best sample by in your respiratory tract, and you can get that through your nostrils.
Oo. And the antibody test is yun nga yung piniprick yung finger, ilalagay yung blood mo doon sa kit, no, na parang pregnancy kit, and titingnan mo kung positive ka for antibodies. But if you are positive for antibodies, does it mean that you are COVID positive?
So again, assuming you have a good, reliable antibody test that has been approved, it means that you probably had a previous infection,
Yeah.
and are not currently infectious right now.
So you
It
have
means you have some sort of immunity.
may protection ka na. Pero not necessarily from SARS-CoV-2 ba? Baka pwedeng sa ibang uri ng coronavirus, ganun ba 'yon?
So there are different kinds of coronaviruses. In this case, it depends on the test you performed. So if you're taking a test for again, a good antibody test for SARS, that for against SARS-CoV-2, that means you produced antibodies, detectable amounts of antibodies for that virus, indicating a past infection, and therefore not currently infectious right now. It's important to note that we still don't know how long this immunity lasts.
Yeah.
So we're still trying to figure that out. But at least at this moment, you based on the best available evidence, you had a past infection. You're not actively infectious, and therefore you have antibodies that are detectable.
Okay. And you mentioned a while ago about testing positive again for coronavirus right after being tested negative. Kasi ganun yung mga nagre-recover eh. Nag-test negative na sila for COVID. Tapos after ilang days lang, nag-test positive na naman. Pero sabi mo nga, baka remnants na lang yon. Are, are they infectious? Kapag nag-test positive sa ila uli for the remnants? Kung remnants na nga lang yun ng
Again,
virus. Oo.
yeah. So um,
Do they
I
have to
can't give you
quarantine themselves again pag nag-positive sila?
again that will again there are you should be really guided by clinical symptoms in addition to the testing, and so that decision should be held should be decided together with the doctor and other healthcare professionals. But what I can tell you is that at least in the States and Europe, um, if you get if you do PCR testing twice within 24 hours that are negative, you are generally considered not infectious.
Okay.
So so if you get swabbed in day one and then swabbed again 24 hours later and they both get negative,
Yeah.
then you're generally considered not infectious.
Okay. Bakit saan pa nag-hide yung mga remnants na yan? Why do they come out after, di ba? Parang after several months, okay ka na, biglang, ay, meron na naman. Nagtatago ba sila?
Again, again, these are, again, when you're infectious, you make thousands, if not millions, more copies of the virus itself.
Yeah.
So even if you don't have an active infection, there could be these so-called dead or inactivated viruses just hanging around in your respiratory tract. Again, this is just
Tumatambay.
one theory. Exactly, but that doesn't mean you're actively infectious. And again, it may take a while for them to properly degrade or be cleared out.
Yeah.
So again, one thing, again, like all testing is not 100%, perfect. So we have to keep that in mind. There's always going to be a chance of false positives, false negatives, and everything in between. So I know there's a lot of confusion with testing.
Yeah.
But what I hope is that if we were able to test enough people, we can really have a good control in this virus. And I hope I hope we've made a lot of improvements in the past months or so in our testing capacity. But I would argue we still have a long ways to go to have sufficient testing to take control of this virus. Otherwise, we would have this perpetual, MECQ to GCQ,
Yes.
back and forth. So
Siguro, ang itatanong na lang natin do we need to test everyone?
that is a good question, and my answer would be, well, no, because we don't have the resources and it's not practical. But because we have uncontrolled community transmission, at least in Metro Manila, we need to be testing more asymptomatics. We cannot test everyone because we simply do not have the resources, but we can be smart in testing. So some people say, the Philippines has been testing more than all these other Southeast Asia countries, and that is true. But you have to understand, because we have widespread community spread.
Yeah.
That's why we needed more testing, right? The other countries, not only are they much smaller, but because they control the virus, they don't need to test that much. They can if they want to, but they don't need to, because they have effective contact tracing systems that once they detect the virus, of course they would want to test regularly healthcare workers and close contacts and people that have been in contact with someone that has been positive. But because they got in control of the virus, they don't need to test as much as we do. But given that we have uncontrollable community spread right now, that's why it's necessary for us to test more.
Oh, of course. But you have to test only those who are, you think are exposed, no? Yeah, yung mga,
Well,
syempre.
that is the current
Mm-mm.
guidelines right now.
Mm-mm.
But hopefully, we're working on ways to make it much more cheaper, and therefore expand the definition so that we can test a much larger group of people called asymptomatics.
Okay.
So while we cannot test everybody, and again, just when I say testing a lot more,
Mm-mm.
it has to be regular testing, right? It cannot just be one and done. Like I said,
Mm-mm.
the test is only as good at the time you got swabbed,
Mm-mm.
right? You can be immediately infected after that, right? And the
Yes.
test will not pick that up. So that's
Mm-mm.
why that's why you cannot conceivably test everyone in the population,
Mm-mm.
because we have 100 million here. That's
Mm-mm.
100 million, you
Test
know
kit.
in 1 week, right?
Yeah.
We need another 100 million tests in 2 weeks, right?
Yeah, yeah.
That's not realistic.
Of course. So,
But but in general, we need more testing, not the whole population, but we need more testing for a larger amount of population, especially people that if they want to go back to work,
mm-mm.
if people want to go back to school. That's why testing is so important. So while we cannot test everyone, we should test a much more larger group of people,
Mm-mm.
in order to get our livelihoods back and get the economy up and running again.
Yeah. And what are you exactly doing right now with the PGH? What are you working on?
So right now, you may have heard, there there's something called pooled testing,
Mm-hmm. Mm-hmm.
right? One of the things that I've been working at PGH, uh, and a another, I guess, organization or task force called Task Force T3, which stands for uh, test, trace, and treat,
Mm-hmm.
is this pool testing, where typically one person, one kit.
Mm-hmm.
For pool testing, we can do 10 people per kit, per
Mm-hmm.
one kit,
Wow.
right?
Mm-hmm. Mm-hmm.
And if all so we can combine all their swabs and
Mm-hmm.
just use one kit, and that would save us in test kits, right?
Mm-hmm.
Which are
Mm-hmm.
expensive.
Yeah.
So if the whole pool tests negative, then they're all good to go, and we save on instead of using 10 test kits, we use only one.
Mm-hmm.
So that is one strategy of trying to lower the cost of testing.
Yeah.
There are also other strategies right now, that I am working on, and
Mm-hmm.
hopefully will be implemented in the coming months.
Mm-hmm.
That in addition to the pool testing, and right now I'm not ready to say what those are, but
Yeah.
rest assured that there are lots of scientists at UP and across the world, really, that are really trying to work together to have more accessible testing, so that everybody can be tested, and therefore we can go back to our lives to be back to normal before the vaccine arrives, or if it arrives.
Yeah, and we are very, very thankful that you are here with us to help our experts here. At sana nga magtagumpay yung inyong isinasagawa ngayong pool testing, and of course the other projects that you are working with the experts of UPPGH. Maraming maraming salamat, Dr. Marvin Nayan. Oo.
Thank you po.
And take good
Thank
care
you
of
for having me.
yourself. Oo, bumati ka muna sa Filipino, dun sa mga kamag-anak mo rito. Do you know how?
We'll see.
Hindi na. Di bale, mag-aral ka, Dr. Marvin. Sa susunod, Tagalog na yung interview natin. Thank you so much.
Okay, maybe next time.
Yes, and of course, we'd like to thank also your cousin, Dr. Deo, and Parawan, who helped us facilitate this interview. At saka syempre, ang kanyang wife na aking pamangkin naman, si Selene Parawan, Selene Santa Maria Parawan. Maraming salamat. Have you been going around, or hindi ka na nakapasyal dito sa Philippines?
Uh, you know, uh, Well, not. I don't think it's right for me to go around right now. But again, that's why I'm here. So we can go back to normal. So
Yes.
that is what I hope to do.
Yan.
So
And we are very, very thankful. Si Dr. Marvin Nayan po ay fresh graduate ng kanyang doctorate degree diyan po ng molecular biology diyan po sa Harvard, MIT at na-stranded at tumulong dito po sa Pilipinas so, para ma-resolve natin itong problema natin sa testing. And of course, yan po, narinawan natin ang tungkol sa RT PCR and the rapid test and the antigen test. Thank you so much, Dr. Marvin Nayan. Take good care of yourself. Maraming salamat.
thank you. Thank
Okay.
you.